Hi, everyone. Thanks for joining us again. I'm Steve Main with Fitness for 5 and Fitness for 10, back with Dr. Nario. He's with Biointegrative Health Center in Reno, Nevada. You can check them out online and see what kind of treatments they do, IV, drip, shots, all kinds of stuff. So you can check them out online. It's Biointegrative Health Center. Welcome, Doctor.
Thanks, Steve, for the invite again.
So let's talk about B12. B12, it's always talked about, and people want their B12 shots or IVs or whatever. So there's a lot of B vitamins. So what is B12?
Well, Steve, that is again another common supplement that we always have in our shelves at home. And again, it can be found in the form of a single B12 or it's mixed in your B complex and usually found in your local grocery stores or health food stores and even online. The thing here is B12 is always known for the function of helping our red cells, the nerve function, and the DNA formation in our cells as well. B12 is always known to be a water-soluble vitamin, meaning, yes, you can pee it out, and overdosing, not that much. And you have to remember it's usually an animal-based type of vitamin, and it's usually naturally found in animal sources. And it also has a mineral called cobalt. That's why another term for the vitamin B12 is cobalamins. And there are three active forms of B12 that is involved with the metabolism found, may it be in oral supplementation or injectable forms. One, the most common that we hear is methylcobalamin. And this is the metabolically active form and always used most of the time for neurological problems, numbness, tingling, memory. It's all those things. Another one is cyanocobalamin. If not given as an injection, it can actually be lost through the kidneys that easy. But caution with this one, the word cyano alone is cyanide, meaning it can be metabolized so that, and cyanide, as we all know, is brain toxic. And lastly, it's hydroxycobalamin. This is the highest form that has the binding affinity in terms of proteins. It sticks with proteins the longest. That's why it's called the long-acting form of B12.
Okay, so why is it good? What do we use it for? What do we use B12 for?
Well, Steve, B12, and along always with its buddy, folic acid, is needed to convert what we call homocysteine to methionine. And methionine, I'm going into medical terms now, but just I'm going to give it the simplest way that I can. Methionine is the universal methyl donor involved in numerous body reactions in our systems, thus making hormones, creating proteins, repairing DNA. And going back to homocysteine itself, homocysteine, you don't want that to be high, meaning when that is high and it's unattended to, it now leads to coronary or heart disease and also increased chances of strokes. That's why homocysteine's ability to form clots and destroy blood vessels is lowered down when you give B12. That's why this is the reason when you hear about vegans still having heart attacks and strokes, it's not because they ate so much animal protein it got stuck in the form of cholesterol in the blood vessels, but it's because they were not taking B12 and the inflammation actually from homocysteine produced the stroke and the heart attack in that specific patient. So high levels of homocysteine is also related to neurological diseases such as Alzheimer's and dementia. And another use for B12 is to form our red cells perfectly in terms of size and shape so it can carry oxygen to the different organs and tissues of our body.
Is there what are some of the indications or signs maybe that we don't have enough B12?
Yeah, that's a good question, Steve. So it's very tricky to identify B12 deficiency because there are what we call specific symptoms and non-specific symptoms. So you would hear about, anemia. Most of the time you'll only see that in a blood test, but you see in your blood sample that there will be larger red cells, meaning they're like what we call megaloblastic. And when I say non-specific, would be fatigue, constipation, loss of appetite, weight loss, difficulty to balance, depression, confusion, dementia. So as you can see, it's like it could be anything, but there are also specific ones, as I mentioned to you, the anemia, and also now we're leading towards poor memory, sore mouth or tongue, numbness and tinglings of the hands and the feet. But majority of the time, neurological issues are the ones that you would see in vitamin B12 deficiency. And if you see that, that needs to immediately be addressed, because when nerve damage is there, it's hard to repair. And that's why assessing B12 levels is very important, meaning the blood test. And most of the time, your doctors will request for a B12 level, but that is not really accurate. But the reason that it's not actually looking at the real levels inside the cell. And the best way to determine that for you to tell your doctor is to get what we call an MMA blood test, meaning methyl malonic acid. And that indicates and tells you how much B12 is inside the cell, which is more important than the one outside.
So what can cause B12 deficiency? What are some of the causes? Why does it happen?
Well, so this is something that is really a topic of discussion, like where is it coming from? And Steve, lots of patients are really intrigued by this. But here's something that most of people don't know about. Stomach acid, meaning hydrochloric acid, is something that you need in terms of absorbing and getting more ample B12 levels in your system. So hydrochloric acid in your body interacts with animal protein to digest that. And by digesting by hydrochloric acid, now it releases B12. So if you don't have that, if you have low acid in your stomach, you already lost that B12 that is in that food source. And when you talk about synthetic or fortified B12 in food, it does not involve the hydrochloric acid interaction anymore, because these are already, meaning when I say synthetic, it's supplementation. And it does not go through this process anymore. And that's why, again, but that's not the end of that. Even though you're not using hydrochloric acid with your supplementation or fortified B12, there's an enzyme called intrinsic factor that's also secreted by your stomach. And this is also now the buddy system of B12. They need to bind together in the stomach. And when they travel together down to your small intestines, that's the one that pair will be the one that's absorbed by your small intestines. If it's missing the intrinsic factor, that B12 cannot go in there. And that's why aging is a very important factor to consider, because as we age, we now have lower stomach acid, and meaning our stomach is atrophied, and also intestinal problems now increases with celiacs and Crohn's disease. And again, vegans and vegetarians are very prone to have low B12 because of the non-consumption of animal meat. But also it's less, the less risk will be on the lacto-ovo vegetarians, which takes dairy and eggs in.
Okay, so I know that you give B12 in multiple ways at the clinic. People can take a supplement, a vitamin, but what are some of the different ways that someone can receive B12?
Well, Steve, there are so many ways on getting it, but let me point out the most common ones out there. Number one, fortification. So you would see this in food. The government puts B12 in whatever we eat, so we won't have deficiencies. Number two, oral supplementation, which is the one that is, again, another common one that is out there, and injectable. So here's the suggestion advised by the Institute of Medicine. Anybody, any adult more than or greater than 50 years old should be on B12 supplementation. On medical studies and research, oral absorption of B12 supplements such as sublingual, tablets, lozenges, actually it has a low capacity in terms of absorption. A good example for you would be 500 micrograms of an oral supplement. Only 10 micrograms is absorbed by a healthy individual, but more if you have age and you have lower hydrochloric acid, and lower intrinsic factor. So that's why when we see deficiencies, we always use injectables on our patients, such as when I told you about the anemia that you see on a blood test. And also when people have malabsorption, such as celiac, Crohn's disease, and that would offer immediate repletion to these specific patients. So we have patients who are very fatigued. By giving an injection, you can see immediate changes. And again, we offer two ways in giving injectable B12, one intramuscular muscle injection and one intravenous, which is through your veins. So as you can see, this bypasses the gut, meaning the gut where the problem of absorption is, ensuring maximum delivery. In most countries, intramuscular or intravenous B12 is the way to treat deficiencies as their standard treatment protocol.
Wow, very interesting. Okay, thank you, doctor. That's Dr. Nario, Biointegrative Health Center, and we will see you next time. Thank you.
Thank you, Steve. As we all know, the knowledge is power, and thank you for letting me provide you with the edge in longevity and health maintenance, which I call the biological edge and the bio edge.